Hello, everyone. Thank you for joining us today for our March School Nurse Professional Development webinar. Today's topic is the how and why of the SNAP Medicaid Link. My name is Tammy Lariviere, and I'll be the moderator for today's session. But I have a couple quick housekeeping topics before we get going. So first of all, PS&I offers 2 regular webinar series, and we alternate between these each month. The first is a professional development series that presents short educational topics of interest to school nurses. And the second is a series of webinars that highlights PS&I solutions. Today, we are highlighting the SNAP Medicaid Link, which allows school districts to automatically send nursing services to their Medicaid billing company. Second, our session today here is scheduled for 30 minutes. We will be recording this and posting it to the PS&I customer portal website within the next few days. So you can keep your eyes peeled for that in case you want to watch it again or share it with your colleagues. And finally, we definitely have time for questions at the end of today's session. So if you have a question, you don't have to wait until the end. You can go ahead and type it into that question area of the GoToWebinar control panel on the lower right-hand part of your screen. So we'll try to answer as many of these questions as we can before the end of our time here today. So now I'm pleased to introduce our speaker today, Bob Bundy. Bob is PS&I's Vice President of Business Development. He has over 30 years of experience across several different industries, including insurance, healthcare, government, technology, and K-12 education. He's been involved in K-12 for almost 20 years now and is a nationally known school Medicaid consultant. As a public speaker, he regularly presents to state and national groups as well. So Bob, if you are ready to go, I'm happy to turn the session over to you.
Thanks, Tammy. I appreciate it. I wonder what you would do if I said I wasn't ready to go, but we'll find that out next time. Thanks everybody for joining today. I appreciate you taking 30 minutes out of your day to join us on the webinar. Today is World Meteorological Day. For those of you who are wondering what the weather's like here in Arizona where I live, it's 70 and sunny right now. I just thought I'd pass that along. Winter is over every place. Now, I've worked with school districts on school Medicaid issues all around the country for years. And I know people always have lots of questions about school Medicaid. So as Tammy mentioned, if you do have questions as we're going along, type them into that question area of the webinar control panel that usually floats on the right-hand side of your screen here on GoToWebinar. Now, I always tell people who attend my webinars that the best chance you have of getting a solid answer from me is to ask a ridiculously easy question. Those are the kind of questions that I am best equipped to handle. The easier they are, the better I like them. So here are my objectives for today's session. First, I'd like you all to understand the flow of the information from your nursing office to the state Medicaid agency. Now, it's not really a complex flow, but I think it always helps people to understand the why of what they're doing rather than just doing it or being told to do it. Second, I'll explain the part that the SNAP Medicaid Link plays in getting your nursing documentation to the state Medicaid agency, and I'll explain kind of how that works. Now, a couple things before I get going. If you are a nurse leader or administrator listening today, you would probably interact with the SNAP Medicaid Link on a periodic basis, but there's not a whole lot of functionality there because it's mostly automated. So I'm not going to do a big demonstration today. I do have screenshots that explain the functionality of the Medicaid Link, but no 7 or 8 hour demo today, which I'm sure really breaks you all up, right? Second, if you're a school nurse, you may never actually see the SNAP Medicaid Link yourself, but it's definitely having a huge impact on you. As a matter of fact, the biggest impact of the Medicaid Link is on the school nurses, and I'll explain why during the session today. So as school nurses, you're going to provide the services and care that your students need. No question, if they walk in the door, you're going to give them the services they need, right? Your state school Medicaid program may reimburse your school district for some of the services that you're providing to your students, but they're not going to reimburse your school district for all of the nursing services that you're providing. That's just kind of how school Medicaid works. So the services that states do reimburse varies around the country. So some of you live in states where the only nursing services that Medicaid reimburses for are those that are listed on a student's IEP in a form like this. That's how it works here in Arizona, where I live, where I might mention it's still 70 degrees and sunny. But here in Arizona, the Medicaid program only reimburses for nursing services if they're listed on the IEP. And it's that way around the country in a lot of states. Now, others of you live in states where services on IEPs are eligible for reimbursement, but so are services that are listed on other types of plans, things like 504 plans or individual health plans or IHPs. Those are just some of the Medicaid business rules that are specific to each state. So for everybody listening today, be aware that if you're from Vermont, your school Medicaid program will have different business rules than the one in Michigan or Colorado or Oregon. And those rules will include which of your nursing services Medicaid reimburses for and which ones they don't in your state. So the record of your nursing services has to get from your school district to the state Medicaid agency. So as a school nurse, you'll be seeing and treating students all day long. And if you're a PSNI customer and you use SNAP, you'll document your meds, your administrations, your visits, your screenings, all that stuff in SNAP. And it would be great if SNAP would send your services directly to the state Medicaid agency, but it can't. And it can't not because it isn't technically possible, because it's actually pretty easy to do that, because there's almost 100% chance that your school district is working with a Medicaid billing company that's sitting between your district and the state Medicaid agency. So your services documentation needs to go to the billing company. And that's actually a good thing for your school district. Billing companies have experience doing a lot of things that school districts either can't do themselves or they just don't want to do themselves. Things like applying some of the business rules, the Medicaid specific business rules that go with your state, or formatting the data the way your Medicaid agency requires it in one of the HIPAA standard transaction sets, or maybe even checking to see if students are really Medicaid eligible, because that's the way school Medicaid works. They will the Medicaid agency will reimburse for services provided to students, but only if they're enrolled in Medicaid, right? So your billing company will get your nursing services, but they probably are getting all the medical services that your school district is delivering, not just your nursing services, but the PT and the OT and the school psychs and personal care assistants or audiologists, all those kind of things. Now, years ago, when all of these billing companies went into business, they had to figure out how to get that information from the school districts. And years ago, they almost all started off with paper log sheets, like the example of the one that I've got on the screen. Maybe if you've been a school nurse long enough, you've actually filled out paper log sheets just like this for just the Medicaid billing purposes. Matter of fact, I just took this off of a website the other night, so there may be some of you out there who are still filling out paper log sheets like this, in addition to the clinical documentation that you're doing to document your services. Now, most of the billing companies have evolved, and they've developed their own software programs that school providers, including nurses, can use to document the services. But a couple of things about this. I've seen lots and lots of these billing documentation systems. And what I found is that most of these software systems capture the basic information required for billing. And you know, there's nothing wrong with that. Billing companies only need that information to meet their purpose, which is to do Medicaid billing. But as a school nurse, you guys document way more than Medicaid requires because of your profession, your license, and you guys need a more comprehensive documentation, clinical documentation, than most of these billing software packages allow. Now, the other thing is that if you're doing that detailed, intense clinical documentation in a system like SNAP, you'd basically be wasting your time if you had to turn around and either enter it again into another software system or logging into paper sheets just for Medicaid billing. So if you use SNAP, and I realize this was a public webinar, so some of you listening today may not use SNAP, but I'm guessing a lot of you do. If you use SNAP, you know that documenting a medication administration, for example, from a screen like this literally takes a few seconds. And the good thing about that is it also captures everything that's required for Medicaid billing purposes too. If you had to turn around and re-enter information into another system or on a paper log sheet, it would be a huge waste of your time. It's the same thing with a walk-in student visit. Your documentation of a student visit, and here on the screen, I just pulled up a template for, I think, a student headache. You would be filling in all the information here, just like you do with all the clinical information of what happened during the visit. And that's going to be complete, it's going to be clinically accurate, and it's going to be all that you need, excuse me, kind of stumbled there. It will also be all that you need for Medicaid billing purposes. So again, taking extra time to re-enter this information into another system is, one, incredibly inefficient. And I think it would be really frustrating to get through your day and then know that you have to re-enter data again. And I know that you guys don't have time when there's 6 kids lined up outside your door with, you know, a playground injury and an upset stomach, and they need their medications. Last thing you need is to turn around and spend more of your time duplicating your data entry. So the SNAP Medicaid link does not send your services documentation to your state Medicaid agency. It sends it securely to your Medicaid billing company, which eliminates the need for those of you who are school nurses to do any duplicate data entry. All right, so now kind of discuss the flow of information, of how the information gets from your school district to the billing, where it needs to go. Let's talk about, well, I'll talk and you guys will listen. That's the way webinars work, right? I'll talk about some of the specifics of the SNAP Medicaid link. Oh, real quick, looking outside, it's still 70 degrees and sunny, in case any of you were curious. So as a school nurse, you're documenting your work in the SNAP Health Center, or you might be using another system, right? But whatever it is, it's an EHR or a system that's built to work the way you work, allowing you to capture your comprehensive clinical documentation. For Medicaid billing purposes, if your school district's billing company captures data for billing on paper or in their own billing software, you don't need to waste any time doing that. Matter of fact, the best part about the whole Medicaid link is that school nurses keep doing what they've always done in SNAP in basically the most efficient and comprehensive manner possible. So when it's time to send your nursing services data from your school district to the billing company, the Medicaid link, which is kind of running in the background, it wakes up. And it's usually in the middle of the night, either monthly or weekly, kind of depends on what the settings are for each customer. But it collects all the services data that's eligible for Medicaid billing, things like medications or treatments or screenings or visits, bundles all up that data and sends it to the billing company. And a quick reminder, not all of those services that I mentioned, meds, treatments, screening, visits, are reimbursable in every state. Some states reimburse for medication administrations and other states don't, right? So the Medicaid link is going to use those business rules to pull the services that it needs to send for that state to the billing company. Now, as a school nurse probably doesn't even know this happened. All a school nurse knows is that they're not doing more data entry or separate data entry for Medicaid. Now, I mentioned earlier that if you're a nurse leader or an administrator, you probably will interact with the Medicaid link on a periodic and probably regular basis, probably monthly. I'm going to explain now why you would do that. So the Medicaid link has basically one main functionality screen, and this is it. So in the middle of the screen where I've drawn this big red box, you would see all of the services that are queued up and waiting to go to the billing company. So in my little system here, I'm only showing 3 records, right? But if you work in a medium or a large school district with tons of nurses, lots of services, there might be hundreds or thousands of records here. And yeah, you could scroll down and access all of them if you wanted to. When the Medicaid Link wakes up in the middle of the night, it bundles up these records, sends them to the billing company, and then it goes back to sleep until the next time it's supposed to wake up. So if you looked at this screen right before it woke up, you would probably see lots and lots of records. And again, you could scroll down and see them all. If you looked at this screen right after it sent the records, it would probably be blank or close to blank because it had sent all those records and they're no longer queued up. Okay, Bob, so if the Medicaid Link is doing this, why does a nurse leader or an administrator need to come in here? Well, remember I mentioned that the Medicaid Link is applying the business rules for Medicaid in your state. Not all the business rules, but the ones that it has control of. And if any records don't pass those business rules, they won't be sent to the billing company. They will sit here in an error status. And so let's look at a sample real quick. So I've got my 3 records here, and you can see that one of them has a caution sign on the left side there, and that all the data on that line is red. And I hope you can see that, but believe me, the font for that line, everything is in red. That means there's a problem with the record, and the Medicaid Link woke up, it applied whatever business rules it was going to apply, and that record didn't pass at least one business rule. It might not have passed several. And so it's not going to send it. And it's going to leave it there until the nurse leader or an administrator comes in here and looks and says, maybe I should look at that. So by hovering over that little caution sign with your mouse, you would actually see what's wrong with this record, and it pops up this little window right here. Now, sometimes these are problems that can be fixed. That's why a nurse leader should come in here every so often and check out any records that could be corrected. So in this example, the student's record does not contain the student's state ID number. So apparently in this state, the state ID number must go with the record to the billing company, and the billing company probably has to turn around and send it to the Medicaid agency. Well, in SNAP, the state ID is not in the student's record, so the Medicaid Link cannot send this. In addition, looking at the box there, there's a second issue. It's telling us that the student is not marked in SNAP as receiving special education services. And remember, I told you there are a lot of states, including Arizona, where I live, that the only reimbursable nursing services are those that are listed on an IEP, right? If a student does not have an IEP and is not receiving special education services, we cannot submit those services for Medicaid reimbursement. And so in this case, the student record in SNAP is apparently not flagged that this student is receiving special ed services. Now, these are both cases of issues that a nurse leader or administrator could address. Maybe the student ID, we really do have the state ID for this student, we just need to put it into SNAP, or it needs to come over from the student information system. Okay, those things could be fixed. And when those things are fixed, the minute that this student's record gets the state ID and that flag for special education services is checked, these errors go away, and this service would now be queued up with no errors to go to the billing company the next time the Medicaid Link wakes up. All right, so the Medicaid Link will transmit services to the billing company automatically, wakes up in the middle of the night, or again, whenever we configure it to wake up, saving loads of time, takes one more thing off of your plate, and it will stop any records that would fail any of the business rules that the billing company and your Medicaid agency have established. Now, one more thing to mention on this screen. Over here on the left is a panel with a list of dates. Anytime the Medicaid Link wakes up and sends a big batch of records to your billing company, or even a little batch of records, any batch of records, it adds a line to this table over here with the date and the time that it sent the records. Now, I'm working off of a screenshot. If this were a live system and I were to click on any of the entries in that box, then this big center box over here would fill up with all of the records that we sent to the billing company in that batch on that day. That's really helpful for troubleshooting. And the reason I put that in here, even talking about it, is because this happened just last week. I was working with a district. They called and they said that their billing company, a clerk at their billing company, had called and said, hey, we didn't get any nursing services from you. So they came into SNAP, the Medicaid Link, and they saw that, the Medicaid Link says it sent a big batch of records. So we got on the phone with the billing company. We asked if we could talk to their technology team and said, hey, we think we sent you a big batch of records. And the technology team said, yes, you did. We received a big batch of records. But here's what happens. We take your records and we run them through a program here to apply some of those business rules for Medicaid. And guess what? Our program had a bug in it. So it accidentally, or erroneously, I guess, excluded all the records. But you guys have helped us find this, pinpoint it. So we fixed it. We just ran your batch through again and all your records processed correctly. So it's really great to have a record like that of everything the Medicaid Link has sent. Okay, real quick, let me summarize some of the highlights of the Medicaid Link that I've mentioned. If you're a school nurse, you have 0 duplicate data entry. You do what you do in SNAP, whoa. And you don't have to worry about a separate billing software or paper log sheets. Next, the Medicaid Link will apply specific billing company and state business rules and exclude the records that don't pass. That's going to help keep your school Medicaid program compliant with your state regulations. Now, every billing company that we work with wants the data from SNAP in a different format. I think they all get together and just decide that they're going to pick a completely new format for the new billing company. So the Medicaid Link correctly formats the data for each of the billing companies that we work with, so you don't have to worry about that. Medicaid Link is automatic. Typically, we configure it to wake up in the middle of the night, but we could configure it to wake up at any time, right? It wakes up, sends its data, goes back to sleep. That's really cool because it means nobody in your district has to remember to run a report on the first of the month or download a file or send a file to your billing company or anything like that. Last, if any of your records don't pass those business rules, the Medicaid Link gives your nurse leader the opportunity to review any of the errors and fix the ones that are fixable so that those services will go to your billing company, and that helps your district maximize the program revenue. So I'm getting close to the question time. Let me preempt at least one question that I almost always get when we talk about the Medicaid Link. I always get a question of, well, what does this take to get going, Bob? Is this like a 3-month project or a 6-month project? Son of a gun. There it is. Here are a few things about how it's implemented. One, I counted last night. Today we have partnerships with 14 billing companies around the country. Now, some of those only work in one state, but a lot of them work in many states. So we have the Medicaid Link available in lots of states, but it just kind of depends on where your billing companies are. Now, we're always adding more partnerships with billing companies as customers introduce us because they want us to work together. As a matter of fact, I have a meeting Friday morning with another billing company that's been introduced to us by one of our common customers. Now, the Medicaid Link works if you're either a cloud customer, meaning that you're hosting SNAP in our data center, or you're an on-premise customer, meaning you host SNAP at your data center. We have customers in both of those camps. There is some basic configuration that we walk through with you to set up the Medicaid Link. It takes about 10 minutes. Things like the communication details that your billing company sends, where to send the files and those things, what time you want the Medicaid Link to wake up and that sort of stuff. But it's really very basic. And last, we provide training resources both in the form of training documents as well as videos in our customer portal. Matter of fact, about a month ago, a customer called and said that she had some questions after they'd been through training, and so could we get on a Zoom call? So I did, got on a Zoom call. I thought it was going to be the nurse leader and me. It was the nurse leader and her entire nursing staff and me, and they asked questions for about 10 minutes. They were actually really good with the training. They just had a couple clarifications. They wanted to feel confident that they knew what they were doing. So we went over those, and then they were ready to go. So Doesn't take a lot to get the Medicaid Link up and going. So these were my objectives for our session today, and I hope I've met them for you. I wanted you all to understand the flow of the information from your office, from your nurse's office to the Medicaid agency through that billing company, so you kind of have that big picture. And second, I wanted to explain where the Medicaid Link fits into that picture and some of its key attributes. So that is the majority of, that's my prepared part of the presentation. Tammy, if there are any ridiculously easy questions, this would be the time to ask them. And I'm counting on you to filter out the medium, easy, and hard questions.
I will be sure to do that for you, Bob. That was a lot of great information. I do appreciate it. You know, Medicaid is one of those topics that is daunting, especially when you don't have a formal background in it. But hearing you kind of break it down and how simply you can document nursing services for Medicaid through SNAP, it just gives it a lot more transparency. So that's appreciated. But we will jump into those ridiculously easy questions right now. Let's see. The first one is Suzanne asked, is it possible to rebill services that are denied? Good question.
You know, that is a good question. It's not ridiculously easy. Suzanne obviously knows more about school Medicaid than I was hopeful for. Yes, it is possible. What she's asking is a service goes to the Medicaid agency and it's denied for some reason, fails a business rule or something like that, and it comes back. Yes, when we were looking at the screen of the Medicaid Link, and over on the left-hand side was that panel where you could look at the historical records. You could find the claim or the service that was denied and bring it back into the pending list of records, and then fix the record. It could be something like probably not the state ID, but it could be something else. Maybe the provider's NPI number could have been entered wrong in the system. And so the claim went in, but it didn't pay because the provider's name did not match the NPI number that went with it. So you bring it back and you correct the NPI number for that provider, and then it would go the next time the Medicaid Link woke up.
Fantastic. Okay, we actually have a bunch of questions, so I'm going to go through these as quickly as I can. And any we don't get to, we'll email out.
Are they easy?
There, you know, you'll have to be the judge. I might throw you a curveball. We'll see. This one's pretty easy though. Jenny's asking, how can I find out if you work with my billing company?
Oh yeah, that's a good question. Like I said, last night when I counted, we're up to 14, and if you want to know, the best thing to do would be either to call us, talk to the sales department on the toll-free number, or drop an email to info@promedsoftware.com and just let us know what which state you're in, because again, like I said, some of these billing companies cover multiple states, and the name of your billing company, and we could let you know if it's one that we're already working with or if it's one that we should reach out and contact. Great.
Wonderful. This is a good one, actually. This has come up more times than I can count. The question is, can a district use more than one billing service? For example, one company for OT-PT and the other for school nursing services?
You know, I don't know of a reason they cannot. Depends on the state rules. Every school district, when they're going to use a billing company, the billing company has to have an agreement with the Medicaid agency to send records on behalf of the school district. And so if a state had a rule that only allowed one billing agent, then the answer would be no. But if a state didn't have a prohibition like that, then I guess it would be okay for a school district to have as many different billing entities as they wanted to.
Yeah, I've actually heard of this. Some of SNAP users have had the dual. It's not common, but it has happened, which is good information.
Yep.
now we have a question from Deborah, who, just for the record, is also slightly jealous of your Arizona weather. But here in New England, we're doing okay. So don't be too jealous, Deborah. Her question is, can only a SNAP administrator access this tab? And what she was referencing was on the PS&I billing history and preview window.
No, it doesn't have to be a SNAP administrator. We do have customers who give permission for that to, a lot of school districts have a Medicaid coordinator, not having to do with just nursing, but just an overall Medicaid coordinator. And so we can give access to that to those people, who might not be a regular SNAP user or a nurse leader or something like that.
Okay, fantastic. And I'm just going to have time for one more because I know we're cutting it close. The question is, what is the cost for the link?
Oh, that's a good question too. Since this is a presentation about our products, the price for the link is $50 per nurse per year. So if you're a school district that has 2 nurses, that would be $100 per year. But
all right.
you can also contact the sales department to get a full quote for that.
Absolutely. We'd be happy to help you with that anytime. So we are at the end of our time. We have a couple more questions. We'll email those to the individual people that asked them to make sure and get those answered for you. But we will wrap up today's session.